Good evening, Door County and Sturgeon Bay. I'm Dr. Jim Heise, Chief Medical Officer at Door County Medical Center, joined once again by the ever-popular Sue Powers from the Door County Public Health Department. Good evening,
Hi,
Sue.
good evening. Thanks for coordinating this again.
Absolutely. It's week 10, believe it or not. I mean, this has been, I think I said a couple weeks ago, it's kind of like, I feel like Walter Cronkite, where it's just like, week 10 of the siege, we're making our way through. But yeah, so it's always interesting to talk about this, and this has kind of consumed our lives, and I'm sure most people who are watching. So what we'll do is look once again, looking forward to your questions, and really appreciate these last 10 weeks. There's been a lot of really great community participation and a lot of good questions, and so looking forward to answering more. But first we'll do our usual, and I'll turn it over to Sue, and she'll give us our update while I get the iPad ready.
Sure, thank you. So I'm going to give you the numbers, and these are numbers of cases in Door County residents. So everything I give you is regarding Door County residents. Confirmed cases is at 22 today. Of those, 9 have recovered. We've had the 3 deaths. So the total number of tests performed on Door County residents is up to 572. Of those, 502 are negative, and there's 48 pending. And I'll just talk a little bit about something we noticed this past weekend when we were doing our follow-ups. So between Friday and Sunday, we had 3 new cases. And at the start of all this, the follow-ups were really pretty quick when we called to do what's called contact tracing. And that would be, if you're a confirmed case, we call you and say, where have you been during your infectious period after we determine that, and what activities did you do, and who were you around? And for the most part, people were staying home, and that was a quick follow-up. They had maybe 1 or 2 contacts. Now people have just relaxed, and they're out more, and they have more contacts. And there's more follow-up, which you don't have to worry about. We'll keep doing it, but we're uncovering people that are symptomatic and advise them to go for testing. So I guess the moral of that story is just that we have community spread, and it's continuing. And the more people are out in contact with one another, it seems to be continuing to spread, at least from my point of view.
Yeah. And I think one of the things that I've caught myself saying in a lot of different conversations is, this is what we're going to see. I think this is, we use the words new normal. I mean, there's a lot of things in our lexicon, new normal and social distancing and contact tracing and things that, these are terms that we really never put together. Maybe you did from a public health perspective when it comes to contact tracing, but I certainly didn't use that in my lexicon up until, 8-10 weeks ago. So this seems to be the new normal, and I think even as we begin to open back up and hopefully get our economy back going and move toward some degree of whatever normal is, we're going to see cases. So it's going to get to a point where it's not going to be a matter of, oh my gosh, there's a new case. It's just going to be a matter of, okay, there's a new case. How do we make sure that we are keeping everybody safe, making sure that person who's been tested positive is doing well and recovering, and how do we prevent that person from spreading it to others? So that's going to become our new normal and new way of doing business. I also think I think that masking is probably here well over the summer into the fall, wouldn't you say?
I would think so.
Yeah. So I think that seems to be in hearing a lot of the discussions about restaurants and things like that. The social distancing thing, 6 feet apart, that seems to be the way it's going to be for a good while, and masking is going to be the way it's going to be for a good while. One of the things that I noticed, I was out and about over the weekend, and I would say it seemed to be like maybe over 2/3 of the people were wearing masks. And some people, I think, just choose not to wear masks. I think other people, it occurs to me, maybe don't have a mask or don't know where to get a mask. And so we're going to see what we can do on our end at DCMC to see if we can't maybe facilitate that for people that can't get a mask or don't know where to get one. Because it occurred to me that if I didn't do this for a living, how would I go about getting a mask? Actually, I do know how I get a mask because my wife is sewing masks as we speak right this minute. So this is what she does. So So we've already got some good questions, or at least I assume they're good. So all I got to do is get them to come back up. And let's see.
While you're doing that, I might add, I know that the Door County Emergency Response Coalition, the Fire Chiefs Coalition, that's based up north, and their phone number is a lot of places on the county COVID website for one place. They are involved in seeing that folks get masks if needed, and they've mostly responded to groups that need them, but I would give them a call if you're an individual and you feel you need a mask and don't know where to find one.
Yeah. And Holly just asked the question, why isn't masking being emphasized more? I hear today that masks were minimally worn in stores. And all I can speak to is my experience. And, I go to Pick and Save in Walmart and I forget where else I was, Ace. And I see, like I said, it's about 2/3 of people that wear masks. And I think some of it is maybe a sense of, I don't think it's just a big deal. I guess I'll tell you my take on it, and my wife and I were having this conversation. My take on it is, I guess, working in the hospital and having been involved in the care of our sick COVID patients that we had, I guess I would say when you see how sick COVID can make you, you don't want to be there. I don't go around living in fear that I'm going to get COVID. I mean, I think I do all the right things, and if I get it, I get it. But these people that we took care of were mightily sick, sicker than I've seen anyone in my career. And so I guess that for me is like, boy, if people had sort of a sense of that, you might wear a mask a little bit more readily. And I say that also to point out and also making note of the fact that still we're talking about 85 to 90% of people that get COVID have relatively benign disease process. They may feel very sick, they may have horrible body aches, horrible fatigue. Those are some of the things I've heard people talk about, but they recover. So not everyone gets deathly ill, but it's when people do get very sick, this virus is doing amazing things. I don't mean amazing in a positive way, I mean in a stunning way, to the immune system, to the inflammatory system in our body. The inflammatory response we're seeing is impressive. And again, not in a good way impressive. Scary.
Mm-hmm. It's very impressively easy to spread also.
Yeah. Mm-hmm.
So that's my pitch, I guess, to wear a mask. And it has been proven that you can spread it before you have symptoms. So even if you're feeling well, please wear a mask.
Yeah.
You might save somebody else from getting a very severe case of COVID.
I'm trying to maneuver. Here we go. We're getting some questions, as I thought we would, on Culver's. What do we need to know about Culver's? Things like that. We can't speak specifically to the whole situation because some of it we don't know. But I guess, if you look at what Culver's has done an amazing job of quickly responding. They've closed down, waiting for the right advice from public health, things like that. And so they're doing all the right things. They really are. Again, and I've been accused of downplaying some of this, and that's not my intention at all. I guess I just try to let people know how I process this as I go through this. I mean, I was at Culver's, I think, a day before, 2 days before this happened, and I when I found out about it, my heart didn't sink. I mean, I always feel bad for the people that test positive and the people that may not be getting a paycheck now, but they're doing a good job of making sure that this is contained. I don't know, Sue, if you have anything else you want to add.
Well, I got the question today is, can COVID be spread on restaurant food that's carry out? And I know a couple weeks ago you answered that so well. I'm going to let you take that question. Yeah,
I guess what I said is what my information comes from Johns Hopkins, and it talks about how the infectivity rate or the infectivity of COVID, about 0.01% of infections can be obtained, or of rate of infection comes from what you pick up and what you might eat or somehow get in your mouth. So the vast majority of ways that you get this is respiratory in a droplet form. So the other thing is when it comes to things like hamburgers, warm food, things like that, if food is cooked appropriately, it's going to kill anything, any virus, any bacteria, anything. So, you know, I know there's ice cream and there's sushi, not Culver's, but there's sushi, things like that. But I think generally speaking, I have had a chance to hear from and speak with people that are chefs and that own restaurants locally. And boy, I'm blown away by, you know, for the most part, how they know how important it is to be clean. Now, obviously, that's not generalizable for every restaurant. I don't mean to suggest every restaurant is super duper clean, but at least the folks I've spoke to, that's been helpful for me.
And there is a requirement of gloving if you're handling prepared, ready-to-eat food. So.
Gene says, those people were the very few that were hospitalized. Don't make it sound worse than it was, or than it is. That's true. That's absolutely true. Doesn't mean that they weren't sick as a dog. Just saying. That's all I'll say about that. Let's see. Can businesses in Door County make mask wearing mandatory?
Well, I think if they're a private business, they can post that and ask you to do it and ask you to leave, kind of like the no shirt, no shoes, no service sort of a deal. I would be very surprised if there was any ordinances to that effect from any municipalities or city or county, because I'm not sure if that would be enforceable. Or practical, I guess.
Here's one, just trying to read this through. Would we support voluntary testing sites for anyone seeking a test in Kewaunee and Door County? Calumet County is offering this free to their residents with 40 confirmed cases. Then there's a bunch of other stuff that he's talking about. You know, what I'll say about that is I personally, as a doc, I'm interested in testing as many people as we can, because I think that's going to help us in a number of ways. It'll help us to know how pervasive is this in our community, what's the percentage of people that actually get very sick from this, as the gentleman just took me to task on about overstating it. You know, yes, these people that are very, very sick, I thought I pointed out that this is a vast minority, people that get deathly sick. But that's where testing will help, because we can actually see, is the death rate, if the death rate is 3 out of 10 versus 3 out of 10,000, you can imagine that's a big difference. And so that'll help us to better clarify. We also don't have a good handle, I mean, we meaning the medical community, don't have a good handle yet on how much of this is around that we don't know, how much is asymptomatic, things like that. So a lot of whether or not we do mass testing has a lot to do with availability of labs, availability of testing supplies, and also availability of bodies, people to do it. If you notice in Green Bay with JBS and all that testing, the National Guard came in and basically took over that testing. They are running the show at the Resch Center, at least to my understanding. And they also are getting the results back, and they are calling all of those people with results. And so they have, so to speak, a small army of people that are working through this. So I think certainly the desire is there to test as much as we can. My desire is to test as much as we can. And I think as we evolve and continue to go through this, we're going to see more and more. As you may have seen, if you've kept up at all with the CDC, they are now starting to transition over to where we thought they might, which is, well, maybe we should be testing asymptomatic individuals. So we're kind of evolving into that. So we're getting to a point where I fully expect that we will see the general proclamation that, hey, if you can get tested, get tested. We'll see how that plays. I don't know, Sue, if you have any insight.
Yeah, I can speak to what the plans are coming down from the state for community testing. And so far, their criteria is if the local resources are overwhelmed and can't keep up. That's one criteria. The other criteria is if you have an urgent or emergent situation, like a big outbreak like Brown County, they will come in and set up a community testing site and do it just as you described. The other thing they're looking at for every community is testing all the staff and residents of nursing homes, skilled nursing facilities. And so that will be done, planned from the state for every county will be part of that. I don't know the timeline yet on when that will be coming here. And it will be a public-private partnership, so depending on how much the nursing home wants to do and how much they're able to do, partnered also with public health. So stay tuned.
Yeah, and one of the questions, I was just trying to find who it was, I'm sorry I can't quote a name, but was asking the question about the skilled nursing facilities, and the answer is yes. I mean, I think that's going to be happening. Right now it's not a matter of if, it's a matter of when and how that's going to take place, but it absolutely will be happening as far as residents and staff that take care of our residents. So
there again, it's asymptomatic testing. It's, people are not ill, it's just testing everyone to get a better handle on how this is progressing.
One of the, Stacy asked the question, when will the antibody testing become available? So let's just talk about that for a minute, because I know a lot of people have questions and they're really good about that, but there's as a doctor, there's a lot of questions that I have about antibody testing. So first of all, what are we talking about with antibody testing? Antibody testing, and for those of you that know, I'm sorry to go through this, but antibody testing basically is if the body is, well, first of all, an antibody is the body's way of fighting off a bug that comes into the system. So a virus goes into the system, influenza, COVID, whatever, and the body senses it, it goes to attack it, and one of the things that it does in the immune response is it creates antibodies. Those antibodies are then multiplied, and they're all over the place, and so that when more virus comes in, those antibodies attack and kill the invading organism. So with that, it's in the bloodstream. With that, we're able to test the blood and find out whether or not there is antibody present in the blood. There's two different kinds of antibodies that we look at. One demonstrates infection right now, in the best of circumstances. It doesn't always do that. And then one demonstrates long-term, that you've had it and that you still have antibodies present. The tests that currently are available, generally speaking, they're kind of a combination of both, and they basically are saying you have antibody to COVID. So what that will tell you is you've been exposed to it, the virus has been in your bloodstream, and your body has created antibodies. If you haven't been sick, if you haven't felt a thing, you were exposed to it and you got away with not having any symptoms at all, which we're starting to see. So we get that test, and so the one answer it'll give us, we get the little blood test, we run it, and it says, yep, you've got COVID, SARS-CoV-2, which is the current COVID, not the other 4 coronaviruses, but SARS-CoV-2. You have antibodies to that particular bug. You've had it. Whether you've had it, you're dying, but you've had the bug. So it tells you you've had it. What we don't know are things like, does it make you immune going forward? We don't know that yet. And if it does and we presume that it gives you some degree of immunity, how long does that immunity last? Is it forever immunity, like smallpox, polio, things like that? We don't know. That's all things that have to be researched. So the tests are available right now. Matter of fact, we have a commercial ad that can run the test, that we can get it here and we can send it out. So if you're really interested in antibody testing, you can call your primary clinician and they should be able to take care of that for you. The big part of it, though, is with any test, anytime we do any kind of a test, any kind of an x-ray, any kind of a study in medicine, we have a question that we want to answer and we want to know what we're going to do with that answer. How is that answer going to make you better, going to solve something? Sometimes the solution is just knowing, and that may be one of the good answers for COVID. If you say, well, I'm worried that maybe I've had it. Okay, you've had it or you haven't. The other piece that's confusing, and I hope I'm not over-talking this, the other piece that's confusing a little bit is with antibodies, as you might imagine, when the body comes into contact with a virus, how long does it take for the body to make antibodies to fight off the virus? How long does that take? Because it doesn't happen instantaneously. It's protein that has to be built and replicate. So how long is it from the time that you've been exposed to the virus until the time antibodies are present? And let's say you check at this point. So here's where you detect it, and here's where it started, and you check somewhere in here. We call this the window period. There's a window period where you may have had it, but the test doesn't show that yet. So that's the other part, is when is it too soon? So I say all these things not to say that we shouldn't be testing, because we can and we will, but there's a lot of unanswered questions. And I by no means am the smartest doc in the world. We've got a lot smarter doctors that work here in the hospital. So we're working to sort of solve a lot of these questions along with the experts that are around the country and the world. Stacy's question was, when is it available? It's sort of available now. We will have in-house testing for antibodies, probably the latest about the first week of June. So hopefully by then we'll also have, we're kind of following the lead of other organizations as to how are they using it. Other places have the same questions I've just explained to you. We're looking at best ways to use it. We want to make sure that we're not giving people a false sense of something. We want to try and be able to say, this is what it'll tell you, this is what it won't tell you. So long-winded
That's a good
diatribe.
explanation. What I know is that if you test positive in an antibody test, we don't count you as a confirmed case. That's how it works now, at present anyway.
Yeah. Can you get COVID-19 a second or a third time? That's a really good question, and again, the answer is I don't know. Because we've had folks that will retest and they're fine. Their symptoms have totally gone away. They've had no fever, no cough, no symptoms for weeks at a time. We'll recheck them and the COVID genetic test is still positive. And we've talked about this in weeks past. We're thinking that probably is just dead virus that is still able to be replicated and detected by the DNA test itself. But we don't know. We haven't, at least to my understanding, there haven't been any case reports. I'm hedging because I don't think there have been any case reports where someone has been sick, recovered, and then gotten sick in close proximity. There's no way to say at this point of, well, if you had COVID now and you recovered fine and you're over the summer and now all of a sudden in the fall you get it again. Will it be worse? Will it be easier? Will it be quicker? We really don't know. Let's see. Hospitals in Green Bay are now requiring asymptomatic testing prior to scheduled procedures. Are you requiring testing here as residents are able to? Yes, that's an excellent question. The answer is yes. If you're having an elective surgery, elective procedure, let's say a colonoscopy or an upper endoscopy, if you are pregnant and you need to undergo a cesarean section, in all those cases, we are testing prior to the procedure. We're trying to get it down as close as we can to the time, given the length of time it takes to get the results back. We don't, unfortunately, have enough testing to do all those in-house. We have a very limited supply of those, but we're testing every single person, basically, that comes in our building for a procedure or for admission to the hospital. Do we get any shared data from Brown and Kewaunee counties regarding how many of their positive cases came from people who work or commute to Door County?
Yes and no. If there's a case that involves somebody who works here, they call us to do that follow-up and to help with that situation. So we hear about it that way. We don't, as far as case counts, I couldn't tell you what that is,
Yeah.
but we do those follow-ups. We collaborate with them.
One of the things, and Sue kind of alluded to it earlier, one of the things is that if you live in Brown County or if you live in Kewaunee County and you've tested positive, public health goes through and tells you all the same things that you would tell the Door County residents as far as quarantining, what that means. When is it okay to sort of unquarantine, if that's a word? When is it okay to resume going back to work? A lot of things like that. what you can't, the variable that you can't really deal with or you can't really plan for is if someone decides on their own to go out early. If they say, you know, it's been 9 days instead of 14, and you say, I feel just fine, I've had no fever, I don't see a reason to stay in, and then you go up to Door County because you want to get some cherry pie. Those are the things that we don't know, and that's kind of what we, I don't think we're seeing that. I don't think there's been any cases that we're seeing, but that I think is the concern, is that sort of thing could happen. That's kind of, you know, if I needed an impetus to wear a mask out, that's kind of why. It's not so much, you know, those of us, I mean, yes, there's the asymptomatic carriers, but it's also, you know, people are human, and you get sick, you're positive, and you feel better, and you may say, okay, I think I'm going to go out. So I think that's why for the foreseeable future, we talk about wearing masks.
I don't know if you noticed, I was taking really deep breaths when you were talking about that scenario. That's
Yeah.
the kind of thing that I really worry about.
Right.
And I guess I'm just going to put in a pitch for public health. You know, we have done follow-up and investigation in communicable disease for years, forever. What we haven't done and what's brand new is this particular disease, and it's like communicable disease follow-up on steroids. It's extensive, and but we're really practiced at talking with people and explaining things and giving them a really good sales pitch on cooperating with those guidelines. And I like to think the folks we've talked to are following up as we ask them.
Let's see. Paul asked the question, will we ask the National Guard to help to assist us to test enough people to open up safely? I think a lot of that has to do, and I don't know all the ins and outs, Sue probably knows more than I do, but it's really interesting when something like this happens. What I've learned as far as there's emergency management committees that are involved at the local, the county, the state, national levels, and a lot of those decisions happen in those contexts. And so it's not a matter of us at the hospital or someone saying, hey, National Guard, could you come and do this? Because there are times when I sort of say, boy, wouldn't it be nice if we could swoop in and test a lot of people? And thankfully, knock on wood, we haven't had any major outbreaks like JBS in Green Bay. I think if that sort of scenario happened, then that might come up. But I would almost rather that doesn't happen. I don't want to see if that if it would work that way.
So you're exactly right how that works. Our county emergency manager and I have had conversation about, do we need community testing? Should we be gearing up for this? And the indicator right now is that we're keeping up with the testing requests. As the guidelines for testing are relaxing and more people may want testing even if they're not sick, we can keep looking at that.
Yeah.
And
So Sue, here's a good question for you. Lori asks, she first says, I'm moving to the county. So welcome, we're thrilled to have you. Moving to the county. My current county has the same amount of cases as Door County. I'm working from home and don't go out. My husband shops or whatever. When I get there, would I have to quarantine?
it sounds like she's from another county in Wisconsin. So that's a good question. It would be great if you would quarantine for 14 days. However, you know, there is community spread across Wisconsin, so whether that's necessary, that's debatable. It would be really nice if you would.
Jen asks, does the current testing indicate only someone who currently has COVID, and also if they have had it in the past, or is that a separate antibody test? Yeah, the current test, if you come in and you have symptoms, or let's say we start doing asymptomatic, if you come in and say, I'd like to know if I have COVID right now, the current, they call them PCR tests. It's a DNA-based test, basically. It's RNA is what the virus is. That detects whether or not it's in your body right now. As far as have you had it, you know, if maybe people have asked me, you know, my son or daughter or myself, I was very, very sick in December. Could that have been COVID? And what if I got an antibody test? So let's say, for the sake of argument, you were sick 6 weeks ago, and you weren't sure, and you checked an antibody test and it came back positive. That would show that you've had it, but you don't currently have it. It's kind of like what we've heard about the county supervisor, Dave Leno, up in Northern Door. That's a lot of that. That's exactly what we're hearing about. Is he apparently was out of state and felt crummy and didn't think anything of it. Came back and kind of went around, did his business, and then decided. He mentioned it to his. I shouldn't say decided. He mentioned to his physician that yeah, I had this cold, just didn't feel normal. And I'm quoting what I read in the Pulse. So I'm just kind of repeating what I read. But then his doctor at the VA apparently said, hey, we should get the antibody test. And so that's how that was used. But again, that's a good example too of how so in the end, what not positive or negative or criticizing, but what in the end did that get us? Well, we knew that he had it. Didn't change. I mean, thankfully, Mr. Leno is doing wonderfully from what I understand. I don't know the man, but that's terrific. But what we've learned is now that he had it.
Yeah. I discussed the situation with him, and I think it gave him some peace of mind
Yeah,
to know that.
And that's worth something. It really is. Yeah, can you remind people that to properly wear your mask, your nose needs to be in the mask? I'm laughing because I just created a video on this that you can go on to dcmedical.org, and it's under the COVID stuff. It's also on the YouTube channel for Door County Medical Center for that exact reason, because I've seen people that have been wearing masks incorrectly, and what I said in the video is true. Is it's not their fault. I mean, why would you know how to wear a mask necessarily? I mean, it's not difficult, but it's not one of those things we normally do. So it's important. What I can do is just go through it really quickly. Here's a surgical mask, the one that I wore to come in here. We have it off because we want people to be able to hear us. Again, it goes over the bridge of the nose and underneath the chin. So cover your nose, cover your mouth. Those are the two things. If you're like this, doesn't help you very much because you can still get virus right in your nose. The one that I saw over the weekend, and I kind of made a funny about this in the video that I made, is this. I've seen this walking around, and I'm not sure I understand that, because just take it off at that point. So that's how you wear a mask. Yeah, I see people. You can test everyone in the county, but that doesn't address the tourists that come here from all over. How do we monitor these people? Yeah, I think that's. I mean, I'll let you address that in a second because you're wiser when it comes to this. But I guess what I would say is, we're not alone. I mean, it doesn't help us. Obviously, we live here. I guess I look at it from a pragmatic perspective. If we're not alone, I think I might have mentioned a couple of weeks back. I was looking at a place. I was looking to maybe go somewhere later in the summer just to get away. So I was looking at Sedona, Arizona, and I was looking at different hotels for Sedona. And on on TripAdvisor they have reviews, and all the top 7 or 8 reviews of these hotels I looked at were all people from Phoenix or Los Angeles or whatever, and they said, "Oh, what a great place to quarantine! What a great place to live during the pandemic." And I thought, aha! So it's not just us; it's other places too. And I think I know. I don't know this for 100% certain, but I'm pretty sure that we have a bigger, more robust hospital than Sedona, Arizona does. So we're kind of in the same boat. So I don't think there's a good answer. I don't know, Sue, if you have anything to add.
Well, you pointed out, the defenses we have to prevent spread of infection are social distancing and masking and hand washing. And it's on all of us to do that. And of course, we hope all our visitors do that. And if we can encourage our visitors to do that, that would be really nice. We'll keep putting messaging out. And I know the business community is also very concerned. So they're putting messaging out also.
Yeah. This is a great question. Kelly asked the question, is our hospital involved in any research studies? The answer is yes. Actually, we actually gave the first convalescent plasma in the region. We gave our convalescent plasma transfusion within the first week prior to our partners in Green Bay, and that is through the Mayo Clinic, along with the Community Blood Center in the Valley. So that's a Mayo Clinic study. We've also been involved with some anti-inflammatory type medications with long names, and our chief of hospital medicine was in contact with Harvard. There's a study through Harvard, so we are involved now. The Harvard one, we're not actually a part of their study, but we actually are. We are keeping in kind of communication with a lot of large centers, UW-Madison, Harvard, Mass General in Boston. These days with the telephone and with Zoom and things like that, it's really possible to have a global community, and that's one thing I'll say. And you try and look for the positive in all this, and I think we're going to be so much better off from a medical science perspective when we're done, because I think a lot of us have worked together more collaboratively, more than we've ever done, and I think we're going to be way better for it.
I think we've worked a lot more together collaboratively just in our community with the different community agencies, private and public, so that's always a plus.
Yeah. I guess I'll comment on, I see a few comments on masks, about cloth masks. You can wash them, you don't need to sterilize them or anything like that. The other thing I'll point out is when we talk about cloth masks versus the surgical masks versus the N95 masks, we're really, when it comes to consumers, just the public wearing masks, we're not worried about does the mask filter out all but 1%, like N95 is all but 5%. Does it filter out everything? We're not worried about the filterability of cloth masks. We're just worried about an absolute barrier. So if I'm talking with you and I get exuberant and I spit at you, the spit's going to land here and not in your nose where you could possibly get the infection. So that's really cutting to the chase. That's what cloth masks are accomplishing. We've got a few minutes to go. I'll let you answer this, and then this is putting your crystal ball and looking at it. Do you see a second wave coming in the fall?
That's a good question that I would need a crystal ball for.
That's right.
I'm hoping not. Fingers crossed. What do you think?
Yeah, I've read that, I've seen that. I don't think anybody really knows, and I think I try and balance in my own head. My personal thought is that we need to be careful, but we need to open back up slowly and thoughtfully, because we can't keep things closed. I mean, that's not a long-term sustainable proposition. So we have to open back up. But I think the part we don't know is what's going to happen when we do open back up. Are we going to see cases ramp back up? What's actually going to happen? I don't think we know the answer, and I think if we don't open up now versus if we open up 6 months from now, the only difference in my mind is we'll have a far worse economy than we do right now. And I'm saying that right now, people will say, well, the biology is more important than the economy. That may or may not be true. But I think we're going to learn a lot, and I think if we're smart about how we reopen, we keep social distancing, we wear masks initially, I think that'll help us to sort of sort out where is this going to go. We may, what I'm really hoping is that we'll slowly open back up, and come the end of June, we're going to say, you know what, this hasn't been that bad. I hope, because frankly, when we started this whole conversation, I know Sue and I were two very nervous individuals about what is ahead. We were seeing numbers projecting all hospitals being overrun in the next 6 weeks and things like that. And so all of us at the hospital and public health, we ramped up very quickly to get ready for the worst. And I'm very glad that it didn't happen. And I think it's largely due to the community being smart and following some of the initial orders from the governor, things like that.
I'm not sure if you saw it today, there was another emergency order came out from the governor's office, turning the dial, as he says, and allowing in-person retail stores with entrances to the outside to be open with not more than 5 customers in at once. So, in other words, not in a mall situation. And then drive-in movie theaters can be open with some parameters around how they do that.
Yeah.
So.
Here's a good question. I hadn't thought of this. Is there a danger in breathing CO2 long term? With a mask, breathing in your own. Not really. I mean, there is, but if you were unconscious and all you're getting is CO2, that's a different story. But wearing a mask, there's really not a lot of danger because you're with it. You will get yourself to a place where you can take off your mask and take some deep breaths long before that would become a problem. So it's a good question, though. It's a good thought. Where did I see? I see a good question, then I lose it. Yeah, I've heard that singing is dangerous and should be avoided due to COVID. What's interesting about that is if you just think about the science behind it, as we talk, there are respiratory droplets that happen just from talking. I mean, even though we can't see it, that happens just from talking. Obviously, coughing, there's a heck of a lot more. Sneezing, there's even more. Singing is somewhere in between talking and coughing. So there is more respiratory droplets. So the inoculum, the minimum amount of virus that you might need to become infected, you are supposedly, at least based on basic science, you are at increased risk from getting the virus from if you're close to someone singing. I think, again, that's why you wear masks and you sing through masks and things like that. Maybe one of the side effects of all this is that we are all, myself very much included, we're all prone to over-examination and over-analysis to this. As when you start to take your mind down the rat hole of what happens if this, and that's just because we're human and we're curious individuals. I think last question, maybe the last question. I want to give you one before, if I can.
Don't feel obligated.
No, one of the most promising treatments currently being used. It's interesting because right now, to this day and time, the UW-Madison, basically, they're still recommending the best treatment for this is supportive measures, which is really not very sexy and it's really unglamorous, and you kind of say, oh, what about what about this? What about this drug? What about that? And there's not a lot. There's a new one out there you may have seen in the press called remdesivir. That is an antiviral medication that is showing some promise. It actually is a cousin to Tamiflu. Tamiflu's generic name is oseltamivir, and this is, so they're both virs on the end. So it is showing some promise, but from what I'm understanding, it's not a panacea. It's very much like Tamiflu. It may help shorten it. It may help make the symptoms a little less, but it's not shutting it off or curing it. The other question that I saw, maybe think I saw, is what about vaccines? What are we hearing about vaccines? I think there's a lot of work going on. There's tons of companies that are trying to get vaccines up on the market. I know 12 to 18 months for a vaccine from the beginning of this is really aggressive. Mm-hmm. Whenever I hear a politician or anyone say, well, we can't really do anything or open back up until we have vaccines, I don't see that as being a realistic proposition. Because the first thing we have to know is can we develop a vaccine for it? We still don't have a vaccine for HIV. So we don't know that it's workable yet. So we've got to find out. Sue, any last minute words of wisdom?
I don't think so. I think we covered it well.
All right. Well, once again, we really appreciate people participating and asking these excellent questions. As I said, we've been saying for weeks, we'll continue to do this on Monday until this gets boring and we can go back to our normal life. Just a forewarning, next week is the 18th. We'll do it then. We won't be doing it on Memorial Day, so that we'll all have off. But we'll be looking forward to doing this again next Monday. Thank you so much, everyone. Stay safe, stay well, and you're in our thoughts.